morning. I want to call the meeting of the Audit and Compliance Committee to order. Madam Secretary, can you please call the roll?
Director Deere,
Director Deere is here.
Director Ryder,
Here.
Chair Harrington,
Present.
and for the record, other directors present, Director Story.
Present.
You have a quorum.
Thank you. The regular meeting of the Audit and Compliance Committee will be held on Friday, April 19th at 9 a.m. Can I have a motion to allow Director Deere to remotely participate
Second.
in the meeting as a voting member? We have a motion, and it's been properly moved and seconded. All in favor?
Aye. Aye.
Any opposed? The motion carries. Madam Secretary, is anyone registered to provide in-person or virtual oral testimony or submitted written testimony to be included in the record?
I did not receive any registrations nor any written testimony.
Okay. Well, we will proceed with the agenda as outlined, and that's a report from our Chief Corporate Compliance and Privacy Training Officer, Nicole Amru, Chief Corporate Compliance and Privacy Officer.
Good morning. Thank you. Good morning. Okay, today we have to share our metrics for last year, 2023, for both the provider and the county care side. We also have received and filed the annual reports both for the provider, Cook County Health, and county care. And then we'll share our work plan for this year, moving forward, 2024.
Any questions?
Okay.
Here? Are you going to go into it?
Yes. Okay. For year-over-year comparison, for our contacts this year, we are slightly lower than last year. I feel that's due to staffing issues. We had one person on FMLA and one person out on a sabbatical, so our numbers are a little lower this year. Next slide, please. This is on the provider side. We are slightly lower on the provider side again because of staffing. The biggest uptick was in the regulatory policy bucket, 125 to 171 this year, which is a good sign. This means we're getting more questions addressing our policies and regulatory requirements, which is what we would like. Next slide, please. Over on the county care side, we have slightly reduced as well, but we have seen an uptick in our fraud, waste, and abuse activity associated, we believe, with HFS OIG activity. They have a new portal, and the activity that they are putting on that portal is much more than in previous years. Our privacy and security bucket went from 112 to 73. We believe that is down for two factors. We transitioned subpoenas and subrogation responsibilities to county care finance and took that off of compliance's plate in late 2022. And then we also have done in-depth HIPAA education efforts, and we believe that's resulted in less HIPAA incidents.
On the fraud, waste, and abuse, you said there's been a significant increase, 37%. What was it?
We had 269 contacts in 2022, and now it's 305.
Okay, thank you.
Thank you. On the left side, therefore, recoveries, overpayments collected. This year we collected just under 7 million, and last year it was 7.2 million. We believe that it was higher last year because we were still processing the backlog of recoveries due to the temporary suspension during the public health emergency. So we expect moving forward, we're finished with that these will be level out as they were before the pandemic. So around 7 million is probably a good estimate moving forward. And then on the right side, our preventative loss, that was higher last year because our old PBM, our Med Impact, had these types of processes established, but now we have a new PBM CVS, and we are still looking to explore this with them. They didn't have it ready-made. So with that in mind, the preventative loss savings will be lower for the time being until we get CVS up on track. So that's why we see only $30,000 in the overpayments on the bottom right there for 2024. We have submitted both annual reports for the county care side and then the provider side for your review. And then looking forward to this year, we are going to focus on education. We're redesigning and updating our code of ethics that we'll share most likely, hopefully, maybe in the next meeting in April, if not in the summer. We are also updating and doing additional training on our LMS platform. And then we're expanding, we're doing follow-up education also in the privacy realm. And then once we've done all this education, we will audit to see if that training was effective. So we should be able to provide audit results on that training too. Happy to answer any questions.
Are there any questions? Hearing none, can I have a motion to receive and file the FY 2023 annual reports for the County Care Compliance Program and the Cook County Health System Provider Compliance Program?
So moved.
Is there a second? Second. The motion has been moved and properly second. All those in favor say aye.
Aye. Aye.
Any opposed? The motion carries. Now we go to item 4, action items. That is the approval of the October 20th, 2023 committee meeting minutes. These were approved by the board at the October meeting, but are being presented for the committee's review and discussion if necessary. No questions, I assume. Can I have a motion to accept the minutes of the October 20th, 2023 Audit and Compliance Committee meeting?
So moved.
Is there
Second.
a second? Motion is moved and properly second. All those in favor say aye.
Aye. Aye.
Any
Aye.
opposed? Motion carries. The committee will now be going into closed session. Action is not anticipated to be taken in open session after the closed meeting has adjourned. Can I have a motion to go into closed section, into a closed meeting pursuant to the following exceptions to the Illinois Open Meetings Act? Act 5 ILCS 120/2 parentheses C 1 and 29. It's been moved. Can I get a second?
Second.
The motion has been made and properly second. Madam Secretary, please take the roll call on the vote.
Roll call on the motion to go into closed session. Aye or nay, Director Deere?
Deere is aye.
Director Ryder?
Aye.
And Chair Harrington.
Aye.
You have 3 yeas and 0 nays.
The ayes have it. The motion carries. We will now go into closed session.